Hello and welcome to Rebloom, where we talk about facts and empower women. Today, when I'm recording this, it's the 7th of April, and I wanted to do an episode on adenomyosis for Adenomyosis Awareness Month. So I'm going to be explaining what it is, how it presents, and what treatments are currently available. Whether you have this diagnosis or you want to learn about a topic that is really not talked about, I hope that this episode makes it easier for you to understand and that you are able to learn something from today. So, adenomyosis affects 10% of women, and something that I found crazy when I was doing my research was the fact that adenomyosis doesn't have a page in the NICE guidelines. So, for anyone who doesn't know, the NICE guidelines are created by the Department of Health and Social Care in England, and they basically work on the pathways for people who have symptoms and show what healthcare professionals need to be doing. So, for example, for PCOS, they will explain what the symptoms are and they will show them what next steps need to be taken. So, transvaginal ultrasound and stuff like this. And then it also explains the treatments. So, it's used by doctors to let them know what the next steps need to be and also like prescribing information and basically everything that they need to know about the condition. So this is what I use a lot of the time to do my research on the conditions I do episodes on. And it was only briefly mentioned in one page of the NICE guidelines. And this really shocked me because as being in a country where we we have this free healthcare and we are so, for use of a better word, so proactive with trying to help people with these conditions, to find that they don't even have guidelines for healthcare professionals on how to not only treat adenomyosis but how to spot it, how to look at symptoms, and also like the pathways for it, like we mentioned, is quite shocking to me. And this is something that I've seen online that people with the condition. So there is a group called the Adeno Gang, and this is founded by someone called Tanya. And one of the key things that they say is, why is there no nice guidelines on this? Because it is such a important topic, and it's one that is being misheard a lot more than others. And I think that this is why it's so important on the awareness month to talk about it, but also throughout the year. So that was really what drove me to make this as one of the first few episodes that I release. So going into it, adenomyosis is basically a condition where the lining of the uterus starts to grow inside the muscle of the womb. So obviously this is meant to grow outside of this, and it just lines that muscle. So by growing in the muscle, this triggers inflammation, and this can cause so many issues. But one of the key things that stands out is that it results in swelling, and the area becomes enlarged. So some other symptoms associated are painful periods, heavy periods. So these are classed as having to change pads up to every 2 hours, or changing sanitary products every 2 hours. Periods which last longer than the typical 7 days, and also pain during sex. Some other things that link to what I was saying with the enlarged is the pressure in that area, and due to like the thickness of it, bloating due to this increased thickness of the muscle, due to the lining not growing in the right place. There are some theorized risk factors, which I seen in a study by, sorry if I pronounce this wrong, but Kelly et al. 2022. It's CELLI et al. If anyone is interested. These risk factors include short menstrual cycles and estrogen exposure, like high estrogen exposure. However, they've not found currently anything concrete, which I think, definitely flags again why this needs to be talked about more. So I wanted to go through what I think is a top tip and something that I've said previously in my episodes, but being prepared for your doctor's appointment. So, writing down your symptoms, noting how long they're for, with me mentioning earlier, longer periods, heavier periods, writing all of this down and being able to tell your doctor, this is what happened on this day. And it's being able to say my periods have been like this and it's been for the past year or two, or hopefully less time. It just makes the most out of that 10 minutes that you've got with them. And, if you haven't already done this, writing down your symptoms and tracking them, don't be afraid to start now. Don't stress out if you haven't done this already. It's okay. But like I said, making the most out of that doctor's appointment, because I know how hard it can be to even get into the room. So it's definitely something worth, try and get the most out of it whilst you are there. And being able to tell your doctor exactly where the pain is. Obviously, we've talked about pressure in the stomach area. You can explain exactly where, how often this happens, and making a pain diary. So you can find a few of these online. Whilst there is quite a few pain diaries online and a lot of resources, one that I personally would recommend is the Menstrual Health Project's toolkit. So they have like different conditions and their symptoms in there. So, if you're worried about anything, you can kind of see what it could be. Obviously, I'd always recommend going to a doctor and going down that route first, but it just educates you a little bit more. But then at the back, they have some toolkits. So it has stuff to write down symptoms and like from Monday to Friday. It lets you put what mood you're in, what medications you're taking that day. It also has a pain scale. It has like period trackers in, so you can put like the colour of your blood, what symptoms you have, and it just has little things like this in, so that you can see what's going on, you can see when, you can also see what kind of things you need to be looking out for, and what you can talk to your doctor about, and maybe puts it into perspective of sort of what is abnormal and also what is relevant. So I think that's a really amazing tool to have with you when you go to these appointments. So after your initial appointment, if the doctor did suspect adenomyosis or another condition, they would use a transvaginal ultrasound. So what this is it's a way to take images of the body, and an ultrasound probe is inserted into the vagina, and then it is moved around and it takes photos of the uterus. I personally also had this done when I was getting my diagnosis for PCOS, and if you Google it online and look at the probe, it looks very, very scary. I will not lie to you, but it's not as bad as it looks, I promise. In my case, a technician that I had with me, she explained everything really well. I did get a letter through the post as well telling me what to expect, some do's and don'ts, and it was made really simple, and they made it so it wasn't as scary for me. I know not everyone is going to have the exact same experience, but in terms of the NHS, I know that they are pretty good with procedures and making sure that you're okay and comfortable. But yeah, so looks scary, sounds scary, isn't scary. I promise. And if you have had one before, just letting people know. If you do know someone else that might be having an ultrasound, just let them know, your experience, and just, reassure people. Is sometimes people just need that extra bit of reassurance. But yeah, another thing that they can do is an MRI scan. So they use MRIs because it shows the different growth. So tissue looks different. So like the lining will look different compared to the muscle, and it will show up in an MRI as it will an ultrasound. So you can see that the lining is growing in the muscle. So this is why they do it. So I'm going to talk to you about the treatments now. So going on to treatments now, the only cure for adenomyosis is a hysterectomy. Obviously, this isn't suitable for everyone. Every person is going to be different. You know, you might be wanting children still, or you might have already had all your children, and you know, this is okay. You're fine with having a hysterectomy. But if don't feel like you have to have a hysterectomy if you're not ready, no matter what stage in life you're going through, no matter what is happening, you know, even if you've had all the kids that you want to have, you don't have to have a hysterectomy. There is management medications. So these include the inuterine system, most commonly known as the coil. So this thins the womb lining, and this makes your periods lighter, and this can also reduce pain as well because you're having lighter periods. Hormonal contraception can also be given to manage the periods that are associated with adenomyosis at these particularly painful ones and these heavy periods. So that includes a patch and the combined pill. As I mentioned earlier, adenomyosis triggers inflammation, and this could cause a lot of side effects. So one thing that we can give is NSAIDs, or better known as non-steroidal anti-inflammatory drugs. So these are really good at helping with pain management, and they lower that inflammation. Some studies have found as well that it can reduce heavy bleeding. So for example, again, I'm probably going to pronounce this wrong, I am really sorry, but Etrusco et al. 2023, if anyone wants to read the paper. However, it is just important to note that around 20% of women with adenomyosis don't respond to NSAIDs. So if you don't, you're not the only person. And as I said, there are other treatments available, or other management, sorry. So don't be too worried if you don't respond to a treatment. There are still other options, and hopefully in the future, with more research done on this topic and people looking into adenomyosis more, that we will get more available management plans and stuff like that. So before I go, I just want to say, for anyone who is suffering with adenomyosis, or if you know anyone with adenomyosis, one thing is to always support each other, whether that's family, whether that's friends, or anyone in between, male, female, it doesn't matter who it is. Just surrounding yourself with people who understand what you're going through can make all the difference, especially your mental health will be affected with any condition really, and it does impact your everyday life so much, having these sort of conditions that I'm talking about in my podcast. So putting yourself in an environment that is nurturing, that is, no matter who that is, being in the right environment can make all the difference. And don't feel guilty for putting your health first. And I've personally found that I've surrounded myself now in an environment where if I'm having a really off day, people will understand, and they make room for me in a way. So like if I can't go out last minute because I'm in pain, people understand, and they don't make me feel bad or guilty for having to cancel, having to have a day in. And I think that is so important. So definitely, if you know someone, make room for them, and try and understand that conditions which affect periods are going to look different every day, and obviously people are going to be affected differently. It's not linear. It's not, they're going to have really good days, but then they're going to have really bad days. So just try and be aware and allow them to, make space for them, basically, is what I'm trying to say. But yeah, so I hope that you've all learnt something today. I hope I've taught you a little bit about adenomyosis, and if you are worried that you might have it, I hope that you have seen. If you are worried about adenomyosis, I hope me going through what happens after doctor's appointments and that can help you to understand why it's happening and why these tests are needed, and also help you understand a little bit more about the condition. And even if you don't know anything about it, it is really important to still learn about it, and definitely needs to be something that people keep talking about, because we really need it on the NICE guidelines. We really need more research done around this topic. So yeah, I hope you found this episode helpful today. Thank you so much for listening. If you think you know someone who might benefit from learning this, please share it with them. And remember, you're not alone in this journey. And until next time, guys, take care of yourselves. Goodbye.